يا هلا 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 حن قلبي على جمعة الخير هلا حن قلبي على جمعة الخير هلا يا هلا ويا هلا ويا هلا ويا هلا يا هلا ويا هلا ويا
Bismillah ar-Rahman ar-Rahim. It's a Saturday morning, and that means you and I have a date. We're together till 10 o'clock. Assalamu alaikum, welcome to the show. And I sincerely hope you're going to keep us company right up until 10. You know the drill. If you keep us company by calling in on the open line, which is 01108 67777, you can walk away with a sweet hamper from Broadway Sweets, or a hair care hamper from Amca. But lots of interesting interviews lined up for you this morning. We're going to be talking SOS Children's Villages in keeping with the 16 days of activism. We're also going to be talking about school readiness and then breast reconstruction and just reconstruction surgery in general with a plastic surgeon, and she is Dr. Eva Siolo. Our second guest talking to us about school readiness is educational psychologist Zakira Mohammed. And our first guest is the National Director of SOS Children's Villages, and his name is Stephen Miller. So let's talk to him. Morning, welcome to the show.
Thank you very much. Good morning.
Nice to have you here. And of course, as I've said, in keeping with 16 days of activism of no violence against children and women, or I would say people in general, we're here talking about SOS Children's Villages. How does the 16 days of activism tie in with SOS Children's Villages?
Thank you. SOS Children's Villages, we have a network of child and youth care centres around the country. Children come to us through the courts. Most of them are neglected or abandoned or abused. And so obviously this campaign is very close to the work that we do, and we're very supportive of it here in South Africa and what the Department of Social Development is trying to do with the campaign.
SOS Children's Villages are all around the world. How long are you in South Africa?
So we started here in the early 80s in a place called Ennerdale, which is in the south of Johannesburg. You might know it.
Of course.
And now we have 11 programs around the country. The concept is around what we call a village. And what we try to do for the children that come to our care is to provide some sort of stability and continuity for them. They come from very distressed backgrounds often. And so we have a mother figure. And the concept is that this mother figure is with us 24/7. She lives in a house with 6 to 8 children. And she becomes, in essence, the mother. And we try to create this family environment. So we've been doing that in South Africa since the early 80s. At the moment, we look after in the region of 900 children in these villages. But we've also started to work more in the communities themselves to prevent the family breakdown from happening in the first place.
So children that come to you, you did indicate that they come through the courts as well. Yeah. Are there ever situations where the parents want to reclaim the children? And if that happens, what sort of intervention or investigation would be done on your part to ensure that the child is going into a safe environment?
So for us at SOS Children's Villages, the villages that we set up are the very last resort. For us, it's all about a child growing up in a family with love, security, and respect. The child's biological family is the best place for that child to grow up. So we are constantly trying to reunite the children in our care with their families. So firstly, it's not coming necessarily from that side, it's coming from us. The court order that brings the child into our care is for a period of 2 years. And after 2 years, it needs to be renewed. We need to relook at that child's situation. We need to relook at their child's family and see whether or not we can work together with them. But of course, we have social workers in the organization. We work alongside DSD, which is a government department responsible for this. And we look very carefully at the families before reuniting the children. And even once the child is reunited with that family, it doesn't end there. We still are paying visits and checking that everything is going okay. But that's our drive, is to get the family working and to get the child back into its natural environment.
So currently, how many children do you have in your care?
So roughly 900, and this is around the country. We have 8 of these villages, and then we also have 3 social centers. But if you look at the children that we're reaching through our family strengthening, it's significantly more. So it comes in the region of 6,000 children at the moment that we're reaching. And by this type of work, what I mean is we identify with community-based organizations. We always work with community organizations because this is a societal issue. It's not something that we as a non-profit organization can come into a community and solve all the issues there. It's an impossibility. So what we need to do is work with community structures on the ground. They understand the situation. They identify the children that we can work with. And then we provide all sorts of assistance to the families in the communities as well. So it's not just our villages anymore.
You spoke about a lot of the children come to you via the courts. Obviously, if they come from very dysfunctional backgrounds, there are lots of challenges.
Yes.
These children end up being very rebellious and delinquent. How do you deal with them, and how do you get them to a space where they do not adversely impact on the other children in your care?
Yes, it's a very complex environment. The children that do come to us very often will be difficult perhaps to deal with in the very beginning. We have our own social workers, we have our own professionals that deal with issues, that provide counseling, that provide all sorts of trainings for the children. But we also partner with a lot of organizations. I think for SOS, that's the incredible thing about the organization, is that we fully understand that what we're doing is a drop in the ocean. The issue in South Africa is so large, and we need to be part of a movement for childcare, a movement that's trying to improve the state of families in the country, the conditions for children. And so we reach out. Where we can't assist with a particular issue, with a particular child's issue, we bring in our partners who can, and we work together. And so, yeah, generally what we see after a few months or a few years within our organization, the children start to become more relaxed, they understand their environment, they start to make friends, and things for them personally start to calm a little bit. But of course, it's a complex environment, and it will remain so. Yeah.
Age groups, from what age is there a cutoff in terms of babies or toddlers, and also at what age do you then ask them to leave, or do you ask them to leave when they reach the age of 18 perhaps?
It's a very difficult question. We do, because the children come to us through the courts, we take children of all ages, so we have some very young children with us. Technically, when a child reaches the age of 18, that is the time for them to leave. But of course, SOS continues to support children who go to vocational colleges or who go to universities, want to continue with their education. We continue to support them. What we realized, we're a relatively old organization. We've been around since 1949, but the early 80s here in South Africa. But what we realized, and what we're really putting a focus on now, is that we have to ensure that these children are self-reliant when they leave us. That is a very difficult thing to do.
What happens if they have nowhere to go to? Let's assume they've lost their families and they've been with you for perhaps 10 years. They've now reached the age of 18, possibly going to college, university, but have nowhere else to go, to a place to live and so forth. What do you do in a situation like that?
If they're going to a tertiary education institution, vocational college, we do support them. We provide a place for them to live. They come back in their holidays and see their mother, who they've been living with for many years. We do provide that continuous support as best as we can. Like I say, we're focusing on youth empowerment, and what that means for a child to be self-reliant, even if you come from a very privileged background, when you leave the home, you aren't necessarily self-reliant. You cannot necessarily look after yourself. So now imagine that for a child that's come from a very difficult background. So it's incumbent upon us to work with the child from a very early age, to understand the environment in which that child lives. What are the opportunities there? How can they get a job? What do they need to study in order to become successful? We need to understand that whole chain, and we need to help the child through and empower them. We're doing a lot more of that. To be honest, in the past, we didn't necessarily do justice by all the youth that went through our care. And a lot, it must be said, Julie, a lot do struggle when they leave our care. We can't necessarily provide what every individual needs.
Sadly.
Yes.
Let's talk about superheroes and success stories.
Okay.
I'm sure there are lots of those.
Yes, of course. So we do have a new campaign at the moment. For those of you who listen to 702, you might have heard about it. And this ties in with what I was just talking about, which is youth empowerment. So we want to put a focus on education. And so we've selected 5 young people who now have a dream of where they want to go, and they know what they want to do, and we're helping them to get there. And what we're trying to say through the campaign is that you as an individual, as a South African, you can be a part of this. You can donate towards the education of these children. And I think that's an opportunity that if somebody took it, would make them a superhero. That's the way that we see it, eh? Because again, to come back to that same point, there's only so much we can do. Our goal, what we want to do, is reach ever more children. If you look at the statistics, things aren't good in South Africa. Things are getting worse for the child. Eh? So we need to do more. We need to reach more children. In order to do that, we need the support of donors. It's as simple as that. We're a non-profit organization. We have no other income coming in. So this campaign is asking people to help us support these children.
And all they need to do is go to your website, as easy as that. And
yes, I would say that nowadays that's the entry point, is through the website, because all the information is there. It's www.sos.org.za, and you can find, or you can Google SOS Children's Villages, and you can find all the information you need. We have a team here in Johannesburg who is very knowledgeable about the work that we do, can provide all sorts of answers to you. And we were talking before we came on air as well about giving of your time, which I think is equally important.
Sure.
As South Africans, every single day we see the societal issues, they right in front of us. Many people want to help in other ways, and we can perhaps provide you with an opportunity to do that.
So again, just go to the website and make contact, and you can offer whatever expertise you have, even if it's a couple of hours a week.
There we go.
I'm sure that would be most welcome. We have about 2 minutes to wrap up time.
Okay.
What can you just give us 1 or 2 success stories with people that have come through your villages, and have they come back to give back to the villages?
Yes, it does happen. You know, what struck me when I first started with SOS, and I've worked in the non-profit sector for a while, and I went to our headquarters, which are in Austria, and we had 133 countries all represented there. Everybody wore their traditional dress. It was amazing. And you see, this is real, this is a movement. And there, what struck me most about the organization was they placed children right at the very center. We had children from all over the world coming to talk to us about how they had succeeded in life, how they were now giving back. And we see that here in South Africa too. And I have to say, it depends on your definition of success too. For me, personally, yes, of course, income and getting a good job, that makes you successful. But poverty is multidimensional. There are many aspects to it. When I see that a child that has come through our care is now a good parent themselves, for me, that is a success.
Absolutely.
And we do see that. People who now understand, okay, let's not perpetuate this cycle. I am going to be a good parent. I'm going to give to my child. I'm going to be a good person. In terms of people who have made a more sort of traditional success of themselves, we do have great examples of it. Just recently, we went to PwC for a meeting with a donor, and they introduced us to one of our former SOS children who was working there. And for us, that was amazing. We don't always speak about these successes because we focused on the difficult aspects of our work, but they really are there. I think finally what's interesting for me, particularly given the difficult times we went through as a country with xenophobia, etc., a few years ago, we have students from our SOS villages around the continent studying here in South Africa. There's about 200 of them studying in universities. They are now starting to give back to our villages here in South Africa.
Marvelous.
To play a role model for our children. And that inter-country interaction, I think, is fantastic.
Let us leave you by giving us a message leading into the 16 days of activism of no violence against women and children. What would that be?
I would say very strongly that this issue of abuse against children and women, it's not something that the government is going to take care of. It's not something that somebody else is going to take care of for you. It's a societal issue, and it's for all of us to get involved. In a small way or a big way, there's different things you can do to get involved. You can speak about abuse. You can attend events with the 16 days of activism. You can donate to organizations like SOS. I think my message would be, get involved. Don't push it under the carpet. Don't see it as somebody else's problem. Get involved. It's a societal issue.
And be the change you want to see around you.
Precisely.
By being kind and respectful. And remember, even harsh words is abuse. So be the change you want to be. Stephen Miller, National Director of SOS Children's Villages, thank you indeed for being with us. May the organization grow from strength to strength, and may all your dreams and wishes be fulfilled as well. Thank you indeed for your time.
Thank you so much. I appreciate it.
That was Stephen Miller from SOS Children's Villages. Please do dig deep into your hearts and your pockets. Go to the website and start making a difference. Let's pay the rent. We'll be back with you in a minute or two. And welcome back on this gorgeous Saturday morning, and we must make shukr alhamdulillah for all the rain. We do know that it's created a bit of disaster in certain areas, and there has been some devastation around us. Let's continue making dua that the rain continues, but without the destruction that we're seeing, so we don't stop making dua shukr for the much needed rain. Next, we're going to be talking educational matters, and of course you do realize over the past few weeks we've been talking about children, about school refusal. We've been talking about the left and the right brain child, the whole brain child. We've been talking ADD, ADHD, and all of those issues. And you might be wondering, why are we focusing on all of that this time of year? Well, moms and dads, you have to be prepared, because your little darlings are going to be going to school early in the new year, and we need to make absolutely certain that we've got our ducks in the row as far as their school readiness is concerned. And that's exactly what we're going to be talking about in the next 20, 25, 30 minutes or so with the educational psychologist in studio with us. She is Zakira Mohammed, and she's going to unpack all of that. Do remember, lines are open, so any questions or comments you have, we're happy to take your calls. Zakira Mohammed, Assalamu alaikum. Welcome to the show.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Jazakallah for having me.
My pleasure entirely. So I would be correct in thinking that it is the right time to be focusing on the school readiness of your child.
It is because it's too late next year to be thinking, is the child ready? Are they appropriately placed? This is a time where you actually gather the information, assess them, see, are they ready, or should we give them a bit more opportunity to develop a bit more? And so this is a time where you can look in and check those boxes. What is also stated in that research shows that a child develops quite rapidly from September to December. So this is the ideal time in between.
We know even they outgrow their shoes in that short space of time.
Definitely. Yeah.
Ms. Angara, in your opinion, I know that over the years, government has moved the goalposts regarding the school readiness age of a child. It used to be 5 and then 6 and then 7. And, we've been kind of yo-yoing between those years. In your opinion, what would be the right age?
Okay, so I don't think there's an answer to that specifically. So what the government has said is that, they're very dependent on age. As just mentioned, they've moved it to 7, unless a child shows a lack of competence in order to complete the next grade. However, there's a lot of research, there's a lot of debate, a lot of argument. For instance, a certain child at the age of 7 would be mature differently to another child at the age of 7. So I think it's very individualized. So from my understanding, yes, age should be used as like a background norm, but it should not be the total. You need to take a whole child into consideration. So you need to look at various aspects Besides various other aspects, except like, you've got the age, but you need to look at their maturity, physical maturity, their cognitive maturity, their emotional, social maturity, and and their motor maturity as well, physical, their motor development as well.
Would that be part of a battery of tests in a school readiness test?
It definitely is. So what we do as psychologists is we look at the child in totality. So we call in the parents, we sit down with them, have an intake, go through the history of a child. We then assess a child. We do a cognitive assessment just to see, where is the child generally at. We do a school readiness battery. What the school readiness battery involves is we're looking at things like their verbal memory, their visual discrimination skills. Are they able to discriminate from what they see? Are they able to process information they hear? Are they able to process the different sounds that they hear? Are they able to discriminate the different sounds that they hear? We look at their fine motor skills, their gross motor skills. We look at if they have developed their laterality and dominance. So are they aware of the right side of their body and the left side of their body? We look at their hand-eye coordination. So it's a very detailed assessment. We also look in the emotional assessment, because emotional, sometimes a child can be ready academically but not emotionally, and the one will impact on the other. So we look at the whole child, and we also do observations from the teachers. We get their input and then we decide.
Ideally, when should mom, let's assume my child's going to be going to school for the first time in the coming year, is this the time I take the child for a school readiness, and the child is probably 6 years old or 6.5, or would you suggest that the child goes sooner, maybe at age 4 or 5?
So I would not suggest it's age 4 or 5, because you're still developing. For example, your two hemispheres, your bilateral integration is still developing, so we can't assess that much at that age. We can tell you, look, this is where their levels fall, their IQ level seems to be within that age, this is where they're still going to be developing. Now, what I'm suggesting is if the child is going to be, let's say now, as you said, 6, going to be thinking of going into school next year, a good time is, although we're saying that development occurs between September to December rapidly, it's a very late time, right? So if you have to come to me now to assess, and then I say, okay, you're ready or you're not ready, it's a very late time in the year to actually find a school for January.
If you tell me that the child's not ready for school, and this child's already 6.5 years old, I, as a parent, start panicking because I don't want my child to miss out a year of schooling. Is there anything at all that the parent then can do, perhaps in those 3 months, to work with the child to get the child school ready? Is that a possibility?
So what we're saying is the school readiness can be enhanced through the environment, through providing the appropriate resources, providing the appropriate stimulation. However, school readiness is just one part. Now, school readiness also encompasses school maturity. That is a biological process that obviously cannot be accelerated. So if it depends what is the concerns. If there are concerns, for example, with their fine motor skills, we can give activities, send them to an OT who can develop that.
Give us examples of fine motor skills. What is it that the child would be battling or struggling with to indicate that this child's having a problem with fine motor skills?
Okay. So fine motor skills, you're looking at the way they're coloring in, the way they're cutting. So using the small muscles, basically. So if they are having difficulty holding a scissor or coloring in, holding a pencil, holding a crayon, those are your difficulties with your fine motor skills. If they have difficulties with fine motor skills, that would affect their writing later on in life. So those are things which OTs can do exercises or do activities to help them improve their fine motor skills. So it's very dependent on what type of area is a concern. For example, a lot of the times I had an assessment recently for school readiness, and the child was making reversals. So the mom was a bit weary of whether should we put them in or will that work out in time. Now, certain things is due to development. Now, if you look at reversals, for example, reversals is, for example, a child writes a B
instead of a D.
Or, so you're reversing the letters or you're reversing the word, etc. So the mom was very concerned with that because they were writing their name, and when they were spelling their name, the one letter was always being reversed around. And she's asking me, should we put the child next up due to the fact that they're making reversals? Now that's a developmental problem. So bilateral integration, that means your right and left hemisphere is fully developed at the age of 8, right? That's where we're saying that after the age of 8, no reversals happens. So up till grade 1, you are allowed a certain amount of reversals. For example, the rule of thumb is in grade 1, 5 reversals. So I cannot say because of that, you should not put, you are
and
allowed.
teacher has to be aware of that. I'm sure she is. When does one start worrying about reversals versus dyslexia? How are you going to know that this child's not battling just with simple reversal, but rather this is an indication that this child is suffering from dyslexia?
Okay, so what we do is for dyslexia, I'm actually, it's right on my early, I've just done a educator workshop with about 200 teachers on dyslexia.
Wow.
And neurology. And you know, that was one thing where giving these educators the information about reversals, and many of them did not know the rules of thumb. I just have to say that. But what we do is we only diagnose dyslexia after grade 3. The reason being is because by then your bilateral integration has developed. So after grade 3, they are not allowed to make any reversals.
And if they do, that's a sign.
That's one of the symptoms. Dyslexia is it needs to, again, dyslexia, you need to take history into account. There's various types of dyslexia. There's a visual dyslexia, there's an auditory dyslexia, and there's a motor dyslexia. That's just the 3 basic dyslexias. When you combine those, in total, they make a number of 7 types of dyslexia.
Ooh, all right. So, can you hold that thought? I'd like to unpack, if you don't mind, a little bit more about dyslexia after the ad break, because I think this is going to help parents and teachers alike to understand where the child's at. I'm talking to Zakira Mohammed. She's an educational psychologist. We're talking school readiness. And as you've heard, we've just touched on dyslexia, which I think is a very important topic to try and uncover a little bit on the show as well. So let's take an ad break. And if you would like to be a part of the conversation, do call in on the open line 011 086 7777. And welcome back. We're talking school readiness with educational psychologist Zakira Mohammed, and we'd love you to be a part of this conversation. Do call us on the open lines. Zakira, before the ad break, we touched on dyslexia, and we're not going to go into it in lots of detail, but can you just give us an overview of where you make the difference between reversals and dyslexia? And if your child is dyslexic, is there hope? What can you do to help this child overcome?
Okay. So in terms of reversals, I've spoken a little bit about the rule of thumb. So basically what we do see is by grade 1, 5, grade 2, 3 reversals, grade 3, 1, and thereafter none. In terms of dyslexia, you need a whole diagnosis. So in other words, you need to see what type of dyslexia it is. You're going to screen for, is it a visual dyslexia? So in other words, are they seeing the things? Are they not? So can they, for example, produce sound out words? So cat, but they're unable to do sight words. These are words that you can't break down. You need to learn from memory. Is it a auditory dyslexia? So are they having problems breaking down words?
Example?
So they can do, this is where they can do the words from memory, but they can't break it down. So this again, the cat, blending it, breaking it down. And then a motor dyslexia, so they're writing things reversely. So that's where your B becomes your D's and your P's becomes your Q's, etc. So they reverse, the Y's and so's, they're writing it. They reverse in the order of words. So with dyslexia, it needs to persist over 6 months. They need it's 6 months or longer. It must affect the child's reading age and overlap and develop other academic functioning. So child will often make mistakes like they'll reverse, they'll substitute, they'll omit words. What also happens is a child with dyslexia also often tends to not want to read. They don't want to read aloud.
Simply because they know they're having a challenge in this area. They can't identify, I should imagine.
Yeah. So sometimes a child, like for example, a child will read the words and it looks blurred to them. For us, we'll be thinking, oh, it's just a simple sentence. For them, it's taking them effort to read that sentence.
So that's the visual dyslexia.
The visual. So, so there's various symptoms which you need to go through. Those are just to name a few. So, there's also, they get frustrated. They have a low self-esteem when it comes around reading.
They start thinking they're stupid and they're never going to overcome. But can they overcome, and with what sort of interventions?
Okay. So, unfortunately, dyslexia is a lifelong condition. But there's many famous people that actually worked to become, for example, can I tell you that NASA has 40% their physicists are dyslexics. Whoopi Goldberg, Tom Cruise, Albert Einstein, just to name a few, are all dyslexics.
Okay.
And yet they've overcome Walt Disney.
I'm wondering, in this day and age of technology and SMSing and WhatsApp, etc., is that further impeding the progress of a dyslexic person, or is it absolute heaven for them?
Well, it depends what type of dyslexia, because sometimes, a lot of dyslexics are visual learners. So they want to see the pictures. They want to see that. That's what technology provides. Some of them are auditory learners. So if you're recording, there's a new thing that is actually coming about, which what they're doing to help dyslexia. So Dyslexic South Africa is gone into partnership with, I can't remember the gentleman's name, but basically they are developing something where they're going to make the books in auditory format, the CAP syllabus. So it would help children actually learn their summaries of the books better in terms of other than reading it. So what we advise in teachers who have children who they suspect children with dyslexia in the class, please do not make them read aloud. Try and do as much oral work as possible. If you need them to read to you, try and let them read to you during break, not in front of the whole class.
Because you're breaking the self-esteem of that child. All right, we've digressed a bit with dyslexia. Let's get back to school readiness. There are those parents who are told that your child is not quite matured at the maturity level of going to school, despite the fact that the child is 6 or 6.5 years old. Your advice would be keep the child back for another year, and then he or she will be good to go. They will not accept that, and they will still push the child to start school. How is that going to impact on the child?
Okay, so number one, if you're keeping a child back with the same conditions is not going to improve. If you're going to keep the child back, you need to provide the necessary interventions as well.
All right, now I'm suggesting that if you have assessed a child who is not school ready, it may be emotionally or whatever other reason, academically. What is it that, and mom's pushing for this child to go to school, what's the harm? How are you hampering the child's future progress in insisting that the child goes to school? So
research and statistics have showed that when a child is not ready, they suffer later on in life academically. Did you know that the government stated that the highest retention rate in grade 1 is due to inadequate school readiness?
Sure.
So that's just grade 1. But often we see, the statistics the government has come out with lately, they say that people are dropping out schools because they're struggling to cope. And why are they struggling to cope? Because they have weak foundational skills. Now, weak foundational starts already at school readiness. So it's like if you're going to push a child when they're not ready and you keep pushing them, it may impact their academic performance later in life.
So you keep the 6-year-old child or 6.5-year child back because he or she is not school ready. What ought you be doing with this child at home for the year? Preschool?
Yes, so I think grade R is very important, as government had mentioned, that they want to implement it in all the schools. And the reason for this is because they want to provide the school readiness to aid school readiness. And so what we're saying is you keep them in the grade R phase, but you provide the interventions. So for example, if it's a child that I say is not ready due to X, Y, and Z, let's provide the interventions so that we could develop the X, Y, and Z. Because if we just keep them back and not do that other extra stuff, they're going to be in the same position the next year.
Little toddlers, these days with both parents being, in the workplace, children are sent to preschool and play school at age 3 and even younger. Is that a good practice? How do the children adapt? Do they need to also go for some sort of readiness, play school or preschool readiness?
So, often we find a lot of children entered in school much earlier, but schools, as long as it's providing a stimulating experience. So I think the onus is on the parents to actually go out there and do the research. What type of school are you sending the child to? Do they have enough equipment, enough play area? Play is so important in terms of play school. Play, because you remember, through play we develop concrete levels of thinking, we develop semi-concrete level of thinking. Those two combined will help you develop abstract level of thinking, which is needed in formal schooling. So what we're saying is that, you need to go out there and say, how much playtime is it? Or are they just sitting in one room, not have much activities? Are they providing things like puzzles? Are they providing opportunities, for example, just a simple thing like tearing paper, developing your fine motor skills, cutting, threading things through macaroni, for example, or buttons. Again, your fine motor skills, jumping up and down, crawling, hopping, gross motor skills. All of those plays an impact in school readiness.
We as parents seem to place a lot of focus on reading and counting and color identification, etc. And I think especially at home, we'd rather have the children doing those type of activities than the other activities you've referred to. What would be the difference, and are we advantaging the child more by the type of activities we believe is going to benefit the child or not?
Okay, so yes, there is a level of where we are, when you're looking for school readiness, you want to see some sort of pre-reading. So in other words, they are able to say a little bit of the alphabets, they are able to identify it, they can see the shapes, they can see the colors, and in terms of counting, they can count up to 10. They can identify natal number 5. But I think we go well beyond that, right? But so there is that added advantage, but at the same time, you cannot neglect the other skills. I know we've touched on a little bit of dyslexia, but just to give you a little bit of an idea, I went for a workshop recently with all different professionals, and we asked them, okay, so if a person is struggling with reading, what do you do when we send them to you? Say, go down to the basics. Allow them to crawl. Allow them to jump, because it's your body that you use as a reference. And when it's your body that will help the bilateral integration, which will then in turn help the reading. So if we're taking away that, we are taking away parts of development. We need to allow them to go out there, develop, play, develop their fine motor skills, their gross motor skills, their midline, just go out there and have a sense of their body. So a big part of school readiness is body awareness. Because if you are aware of your body, you're aware of your body in terms of relation to other objects, that will help you already develop, your foundations for your reading and writing.
I heard a long time ago, or I might have read this, that you shouldn't place toddlers into a walking ring too soon. Allow that toddler to learn to crawl and allow him or her to explore their worlds through crawling. What's the benefit of that?
That is very important. So that again goes back to that Otis, how she treats her patients. And she was saying that, often we say, I wish they can stop crawling and go and walk. They said, a child needs to crawl. Reason for crawling, that's going to develop the right and left hemispheres. Is going to integrate that. You're saying so bilateral integration is absolutely important. And why is it important? It's important for things like reading, for all types of functions. So basically, as we spoke about reversals happens when bilateral integration has not fully developed. Crawling is one of the things that helps towards that. So that I was saying, have more experience, it will, besides the gross motor skills, it will also help the brain development.
The age and the world we're living in these days, we all want our children to end up being little Einsteins. We want to bask in the reflected glory of our children's successes, and we want to go around boasting about how clever our children are. And we all want it, and there's absolutely nothing wrong with that. How can we help our children get the best out of, their preschool, schooling, and going on and beyond. What is it as parents that we ought to and can do without being, too overbearing and too demanding? What can we do to help this child achieve?
So I think the best thing is support the child in terms of, and as you said, we all want our childs, and most of what do you want? Doctors, lawyers, whatever. And it comes back to that Albert Einstein, if you judge a fish by its ability to climb a tree, it's going to grow up believing it's stupid. So each one of our children have special and unique talents. Some may have strengths in one area and others may have strengths in another area. You need to see what strengths your child has and help grow that strength. We're not saying neglect the other things or the areas of development. Provide that help for the areas of development, but also help enhance. If your child has a strength in a certain area, that's the strength you should actually go and help him towards, support them. I think also a lot of the time is parents put undue pressure on them. So, if a lot of the times I actually notice nowadays they want their kids to, before grade R, before even they're hitting grade R, they must be able to read. You are rushing the child's development. Certain things that you need to let a child be a child.
Don't compare your child to the neighbor's child or a family member's child. In closing then, let's just understand, let me ask this final question. Is it absolutely necessary for your child to go for a school readiness test? I'm thinking parents who can't afford the test. How will they know that the child is ready?
Okay, so there's various ways you can see. Let's look at the child from a general development. Can they go toilet on their own? Can they blow their nose? Can they tie their shoelaces? Can they hop on one leg? Can they use a scissors? Can they color in a picture? In terms of cognitive development, can they see different sizes? Are they able to tell you this is the morning, this is night, this is afternoon? In terms of social and emotional development, can they separate from the mother? Are they understanding? Can they see that they can't just demand, they need to take turns? Can they participate in groups? Can they sit? Can they listen? Can they pay attention in terms of in terms of fine motor development? We've covered it. Can they use scissors? And then obviously, do they know their left side to the right side of their body? So there's various numeracy. Can they identify alphabet numbers up to number 5, number 10? Can they count to number 5? Pre-reading. Can they see their name? Do they know how to hold a book? Do they know that you read from one side of the page to the other, from your left to right? And basically, and then obviously you'll have your other developments like, is your child is your child eager, the attitude? Do they want to go to the school? Are they eager to learn? Can they? Finally,
if the child is school ready, as per the a psychologist like yourself, but still resists going to school. So you've had the test, and you tell the parent your child is school ready, but the child is not eager to go to school. What do? You
need to investigate why. There's obviously some deeper meaning why this child is not going to school. What is going on within them that is making them that resistant? Is it the environment? Is it what is holding them back? Is it the anxiety?
Great. We covered that in our school refusal program last week. Thank you indeed for being with us. Is there anything else of importance you'd like to share with our viewers before we let you go?
It's just that, you need to make sure that your child is ready for school for them to be functioning optimally later on in life.
Because an unhappy child is going to result in an unhappy family. Am I right?
Definitely, absolutely.
Zakira Mahmoud, wonderful having you in the studio. Thank you indeed for sharing all your expertise with us, and all the very best to you. Zakira Mahmoud's the educational psychologist, talking to us about school readiness, everything you need to know about getting your child ready for the school year 2017, inshallah. Time for us to take another ad break, and when we get back, we're going to be talking to a plastic surgeon about reconstruction surgery, very especially in light of us having come out of breast cancer awareness. And we do know, sadly, there are those women who has to have or have had to have mastectomies. How do they survive something as invasive as that? But all of that right after the ad break. And we're into the final section of the show this morning, and a rather serious issue. We're going to be talking about breast reconstruction surgery after a mastectomy or a double mastectomy. And of course, we're talking about this because we've just come out of Breast Cancer Awareness Month. And in studio with us is plastic surgeon Dr. Eva Ciolo. She is going to talk to us about how you can overcome this, or how, if you've been diagnosed with cancer and you have to have a mastectomy, the steps and the support in place for you. Dr. Eva, morning, welcome to the show.
Morning. Thank you very much for inviting me to the show, and thanks very much for choosing me to represent the whole group of people who are really engaged in reconstruction and dealing with the patients who are suffering from breast cancer.
Thank you for being with us, and I should say the beautiful Dr. Eva Ciolo.
Thank
you have
very
such
much.
positive energy and beautiful physically as well. So thank you for sharing that energy with us. Now, when we talk breast reconstruction therapy, before we get there, talk to us about your areas of expertise.
Well, I'm quite a long-standing doctor, and my career went through phases, different interests. I went through general surgery, burns, basic plastic surgery training. Then I subspecialized in craniofacial surgery and cleft surgery. Then I took an interest in regenerative medicine, which involves stem cell technology, and at the moment, the platform for it in reconstructive surgeries, fat transfers.
How far down the line are we with stem cell surgery or stem cell research and stem cell therapy as a whole?
It's a very controversial and hot topic still in the scientific fraternity. We're still battling with the transferring the research from the lab settings to the clinical settings because of different regulations and obstructions. But I think at the moment we are at the stage where we know that the body can have a potential to regenerate and to heal itself. And the most important thing is to acknowledge it and learn the language. The body actually talks to us, and the body talks to itself. As soon as we be able to scientifically monitor it and regulate it, I'm sure we will be in the age of more regenerative medicine than medicine which is just treating the disease.
How far down the line are we with this revolutionary form of medicine?
Well, we already know that we can grow certain tissues from stem cells in the lab. We can grow even organs. I recently been chosen by the American Association of Plastic Surgeons to do a scholarship in America.
Wow, congratulations.
Thank you very much. And it gave me absolutely different angle on the whole research on stem cells. I've seen the biogenerators which are actually having little lungs or little vessels, or even tiny little brains growing in absolutely artificial setup. And those organs are growing from the human cells taken from the human body.
Sure, the mind boggles where science and technology is taking us. Is there a place for stem cell in the cancer treatment or the cancer field?
Well, there are quite a lot of reservations because how we handle the stem cells, we are not still sure how to properly control them. And the main concern is that if we introduced stem cells to a body where there is already some process, cancerous process, if it might speed that process by the properties of stem cells. But the good news is that at the moment, the general feeling is, and all the research and large studies which been conducted so far are saying that if you introduce, let's put it that way, fat transfers, which contains some sort of stem cells, which we introduce to reconstruction of the breast on the patients who are free of disease, we are pretty sure that it's okay. It's, as I'm saying, it's not large enough studies. It's not multi-centers yet. But we're getting that way, and fat transfers are getting more and more popular in augmentation of the whole ornamentarium of the breast reconstruction.
Okay. I'm talking to Dr. Siola, and we're obviously going to take an ad break. In the next part of the show, we are going to be talking about breast reconstruction or mastectomies. All right, we won't take an ad break now. Let's continue the discussion, and fascinating stuff, is it not? We're waiting to hear from you. Do become a part of the conversation on our open lines, which is 011 086 7777, and my guest is Dr. Eva Siolo, talking breast reconstruction therapy. Let's get to the heart of the matter. Cancer and breast cancers are obviously one of the killers amongst women. We've just come out of this big breast cancer awareness month. Now, when a woman has to have a mastectomy, it's absolutely devastating. She feels less of a woman. Her femininity is being taken away from her. Where do you come into the picture, and how do you rebuild this woman, not only physically, but mentally and emotionally as well? And how do you do it?
Well, statistics are very, very worrying, because 1 in 8 women in the United States are affected potentially by the breast cancer. And in 2016, the expectations of a new cases diagnosed are about 250,000 people.
Sure. Well,
that's only states.
That is the biggest killer amongst women,
right?
Breast cancer.
Right. So how we deal with it? Because it can affect anybody. Everyone, 8 of us can be affected. So obviously it is a big insult on our psychology. Breasts are being socially and culturally connected to the woman. It's an organ of nurturing. We need that for giving the toddler a boost of immunity. Best food can be provided for a little baby. And on the other hand, we also need those breasts to feel feminine and to feel enough woman to enter that stage of life when we actually ready to have babies, and we can attract, and we can sort of be proud of it. So fortunately, the women during the childbearing period are not so largely affected. The most of the cases are happening over the years of 55 of age.
And that's it's a critical stage of a woman's life, because she's going through the menopause. She doesn't feel good about herself anyway. And then she's diagnosed with breast cancer with the possibility of having a mastectomy. So that's devastating for her.
Absolutely. The psychology is really big behind it. The body image is distorted. The self-worth is distorted. The coping with the position in the society, the coping with the family circumstances. It's a big responsibility to be ill when you're a woman in the family, because you're feeling deficient in terms of filling up your duties as a woman. And obviously the relationship with your husband, even the relationship with your children, they're frightened. What can happen, right? On the top of we frightened, how we cope with that, the whole surroundings are frightened. So it's really complex psychological situation. From medical point of view and from plastic surgery and reconstructive surgery point of view, it is a little bit more technical, I would say.
So this is where you come in with the oncologist. I presume the oncologist will then bring you in. It's a multifaceted team that gets
Yes.
together. So you come into the picture.
Yes.
Let's
Well,
talk about your role.
The structure of dealing with a breast cancer is basically awareness. When we self-diagnose ourselves, when we have our yearly mammogram over the years of age of 40, and then diagnosis by probably gynecologist GP and referral to the general surgeon or breast surgeon, and then it starts a multidisciplinary task. The oncologists get involved, the plastic surgeons get involved, the radiologists get involved, and obviously the oncologist who is introducing the chemotherapy if it's necessary. So it's multitask, it's well organized. Throughout the country there are units in the government and there are private units very well equipped, very astute, very updated in terms of the international updates. So in terms of diagnosis and dealing with it, I don't have a doubt that we're under good care.
So when you're sitting with the patient and engaging with her, obviously she's terrified. She's not sure that she wants this to go ahead because a part of her is going to be missing when she, has had the op. What is the type of conversation you have with her? What is the reassurance you give to her? Firstly, on the mastectomy and then the reconstruction, because that's where you come in.
Yes. Well, I have to say we've got choices, right? And as long as the woman is aware what can happen in different case scenarios and different stages of the cancer, she's got always a choice. So it doesn't necessarily need to be taken out a breast if it's early stage. It can be a conserving a breast surgery with following with the chemotherapy and radiotherapy. It can be mastectomy, which is quite an assurance that in that particular breast cancer will not reoccur, and that also make sure that you're not exposed to so much of the chemical therapy or radiotherapy. Also depends on the stage. But the general approach is that there is probably a better outcome in terms of when the woman having, if possible, immediate breast reconstruction, than if it's delayed breast reconstruction. Immediate breast reconstruction, it's not always possible due to the staging, due to general status of the patient, due to the spread of the disease. But delayed reconstruction when a woman is free of the disease is always possible. So there can be a period when there is no breast and you have to deal with it, but later on it's possible to reconstruct it. Some women have got an option to have immediate breast reconstruction, meaning that when they wake up from the surgery, they in a way distorted mentally because there is no breast, but they have some form of reconstructions which replace that breast psychologically, and you're not feeling that deficient. The conversation with the patient is very difficult, of course, because the first dispute is amongst the specialist. What kind of a treatment we can offer to that particular patient. So it's very individual, it's very individualized, and I cannot tell to everybody, yes, you can have breast reconstructions immediately after the operation, after the mastectomy. But I can say there are options and the utilizing those options will definitely help healing.
So if a patient opts to go for reconstruction, what exactly and how is this going to be done? What sort of synthetic materials is going to be used to construct this breast? What is it going to look like? How's she going to feel? And more importantly, how's her husband going to feel about looking at her, etc.?
Well, the possibilities are almost endless. Right, you can have the breast replaced with the artificial material like a breast implants, or you can have breast reconstructed with your own body, with your own tissue from the surroundings of the breast, or from the distant places on your body like your abdomen or your back. It just depends how much of the surgery involved, how good candidate for specific type of reconstructions you are. When you're a patient, you usually have premeditated by the specialist way to go, and it's just a matter of accepting it or not. So basically, when you diagnosed, when you staged, you are proposed a certain treatment. So if that is a breast reconstruction with the breast implants, you know that you will have a bag full of silicone which mimic the breast and which will be positioned under your skin or under skin and the muscle, depends on the need of reconstruction again. How does it feel? Well, after the healing period, which is always feeling different, you're probably accepting it as your own body and part of your own body. It is also quite individual psychologically. Some people are accepting breast prosthesis very easily and it's just not a problem. Some people are not into it and they need an autologous, meaning your own body tissue, to reconstruct the breast. When it comes to the reconstructing of the breast from the other parts of the body, it is a little bit complicated because we're dealing with a donor site, meaning that there is another area which is involved. So on the top of the breast which is reconstructed, we're dealing with the area which the tissue is taken from, which is either lower abdomen or the back.
And that's also an invasive procedure.
It's also invasive
Let's hold
procedure.
that thought, Dr. Ava, and when we come back, let's talk about what can possibly go wrong. And is there also the possibility that your body will reject this synthetic breast? But all of that after the break. I'm talking to Dr. Eva She's a reconstructive plastic surgeon. In this program, we're concentrating on breast reconstruction surgery, and of course we're hoping to get her on in a future program to talk about cleft lips and palates, so hopefully that will be sometime soon. But if you have any questions or comments around what we're discussing, please do call on the open lines. But first, let's take an ad break. And welcome to the final segment of the show this morning. We're talking reconstructive breast surgery, and of course the plastic surgeon in studio with us is Dr. Eva Ciolo. She's talking about all of those issues, how you feel after you've had the procedure and the type of side effects and the types of features and procedures offered as far as breast reconstruction is concerned. Before the ad break, we spoke about going to other sites to get, obviously, to work on the particular type of reconstruction. And I indicated that that might be a bit invasive. Let's look at the side effects and what can possibly go wrong, because that is, of course, the risk with any type of surgery. There is risks involved.
Yeah, unfortunately, any type of surgery is risky. Even if it looks or feels the most benign, there's always a risk, and I always emphasize that to the patient. But with the right mindset and positive thinking, you can overcome a lot of adversities. complications from surgery can be quite severe, and it also depends on how healthy is patient before entering the surgery. So obviously we've got risk factors. If you're a smoker, if your weight is on a very heavy side, if you have history of some cardiac disease, diabetes, hypertension, it always increases a risk of complications. If you've got some problem with your immune system, your body can fall into an infection much easier than a normal person without a problem. So obviously assessing yourself before decreasing allows to decrease the risk of the surgeries, and also can direct the surgery into less invasive. But when we're talking about complications itself, again, it can be immediate complications when it happens on the table.
Like what, for example?
Like uncontrollable bleeding which requires transfusion. Some people bleed more than the others for some reasons, because there is got lower count of platelets, or the system to form thrombus is much less effective than the others. So you can have a bleeding which will require transfusion. You can have anything which is related to the anesthetic. You might not tolerate anesthetic very well. You might not feeling very well after the anesthetic. The other problem which occurs quite often, not very far from the surgery itself, is the infection. The wound can be infected. The transplanted area of the body from one side to another might get infection, and it might get almost rejected by the body itself. So there are a lot of risks, and I don't think I should really talk all about it, because it will be more scary.
We're just trying to give a very comprehensive outlook on the situation. What happens if the body rejects the silicone implant? How am I going to know that the body is rejecting the implant? What's going to happen?
If you have, it can be again immediate rejection related to the infection, let's say, and if its area is infected, unfortunately, the implant must come out, and tissue needs to be treated, and there is a possibility of re-implanting the new prosthetic.
That's very traumatic for the patient, is it not?
It is very traumatic for the patient. In terms of the delayed presentation of complications, sometimes around the implant there is a scar formed, and that scar is sort of a constricting and obstructing the implant, giving it a little bit different, more rounded shape that it used to be immediately after the operation. And that's probably the first sign, the discomfort and the different look on the breast implant. They're becoming more rounded, more like a ball shape, and that also can be treated pharmacologically with the trial of a specific medication for about 6 months. If it doesn't resolve, unfortunately, again, we have to opt either for regenerative medicine, yay, which we can introduce the fat to sort of break that scar tissue, or we can opt for replacing that implant if it's not well accepted with the other reconstructive.
It sounds terribly traumatic and invasive for the patient. I'm wondering that would you want to go through all of that if a body is not, if she's just not adapting and adjusting to this, the silicone implant or the reconstruction? What can be done? Can't you come to you and say, please take it out and then just leave my body to heal as it is? Because I've had it, it's just way too much for me.
That's why I was trying to emphasize that you always have a choice. And this is the beauty of current medicine, that you have options. You're not left without an options. The doctor is not going to say, you've got no options, we have to do that, then that's it. There will be options presented to you, and you've got a choice, and that choice can be conscious, can be discussed with the family, because obviously there's always pros and cons for anything. If you are left without the breast, there is a psychological problem, which eased off according to the studies about 2 years after the procedure. You sort of get used to it, you accept it, you go through the psychological stages of parting with the breast anyway, and you can probably even accept the mastectomy. And we can see in month awareness of the breast cancer, women who are dealing beautifully, not having both breasts, not having one breast, they just accepted it, and they actually happy that they healthy, they survive the cancer, they free of cancer, and the rest is just a coping mechanism. But on the other hand, if you're more sensitive to that body area and you feel totally depleted, you always have a possibility to try to reconstruct it, as I'm saying. And as I'm going to emphasize again, you always have a choice. You will be presented with the choices. If you go to the right team of specialists, which many throughout the country, and they're very, very astute in their expertise, you will feel comfortable with your decision. You will feel comfortable what's going to happen after the diagnosis and treatment of the breast cancer.
We've looked at the downside and the risks and the complications as far as breast reconstruction is concerned. Let's look at the positive side. Let's look at just how great it can be for you and for everyone around you.
Well, the good news is that cancer is detected because of the awareness and of the good diagnostic, is diagnosed earlier and earlier stages. So sometimes it's just a little lump we have to remove, and it's not the whole breast we have to remove. So there is already a comfort into it. If mastectomy can have to happen for some reason, the psychological recovery can be very fast due to the conscious choices and acceptance, and of course the type of the surgery. And really the amount of surgeries are done in the university hospital and in the private hospitals are really large numbers, and there are large numbers of women who are happy with the breast reconstructions.
Let's look at partial mastectomies, where just a lump is removed from the breast. And if obviously the breast is going to be scarred, is there any reconstruction work that can be done on that breast? And I'm sure it's not as radical as a total mastectomy. What would that look like?
Well, there are a few options, and the point is, probably important point is that with the smaller size breast or breast who are quite ptotic, meaning quite deflated of the volume, that even that lumpectomy can cause quite a lot of asymmetry and quite a lot of scarring. So it will feel that there is something wrong and it needs to be reconstructed. If the woman, usually with the breast conserving therapy, which we are talking about, that volume which was taken out can be immediately reconstructed with a local tissue. There are some specialists throughout the country who are doing it with the local flaps, and it's very nicely and neatly done, mimicking the breast very well. Or you can also opt for putting an implant later on to symmetrize both breasts, let's say larger implant into the breast which is affected, and the bigger, bigger implant to the breast which is affected and smaller to the breast which is not affected. Or again, fat transfers, which are quite well accepted now to deal with the smaller defects in the volume of the breast.
And we've come almost to the end of the program this morning. Your take-home message to all women considering mastectomies, partial or total, what would that be?
Well, as I'm saying, choices are existing. Choosing the right specialist who you feel comfortable with is very important. There are a lot of female breast surgeons, which that makes more comfortable the whole process. And they are available all over the country. They more and more of them surfacing out. The breast cancer is treatable disease. You can be free of disease. You can be reconstructed. You can have normal life. You can function in the society absolutely as you functioned before. But you must remember that there is a period of time which you need to give yourself a leeway. You need to adjust to the treatment, to the recovery, and you need to have a good support system around you.
And with all of that, we hope that you'll feel whole again once again.
Absolutely.
Thank you indeed, Dr. Eva Siolo, for your
much.
Expertise and your presence in the studio this morning.
Thank you very much. It was a pleasure.
And of course, this lovely lady was here sharing her expertise, talking about breast reconstruction after a mastectomy. And that, of course, brings us to the end of the show this morning. Thank you indeed for your company. And let's end off with the quote of the day, which is, "I am too positive to be doubtful, too optimistic to be fearful, and too determined to ever be defeated." A big thank you from the production team, and thank you for your company. See you next week, Wednesday at the same time. And as always, it is Assalamu alaikum wa rahmatullahi wa barakatuh, and Khuda Hafiz from me, Julie Alli.
Ya hala, 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 ya hala. حن قلبي على جمعة الخير هلا، حن قلبي على جمعة الخير هلا. يا هلا ويا هلا ويا هلا ويا هلا، يا هلا ويا هلا ويا هلا ويا هلا، يا هلا ويا